Vestibule nose diseases. So like vestibule is like in a lot of places, but like vestibule as such means it's kind of like an extra part. So vestibule is nothing but the part of the nasal septum which is pinchable between the two fingers. Like specifically speaking, this part where person has worn the nose ring here, so that is the vestibule. So like in between, so like it's the lowermost part of the nasal septum, right? So that is the vestibule, is very hard lips. Anyways, so we will first see the diseases which can affect the vestibule, and then like we see the etiology of it. So just look at these pictures first, and after that we will know more about it. Just like sensitize yourself to these kind of pictures, because like this is the kind of diseases which we are gonna see with respect to the vestibule. So like that, this is like what is the nose openings, and like you can see some tissue here, and that is a disease. This is a kind of like a vestibular disease, but like manifesting inside the oral cavity. This is like a surgery which is like causing a trouble. This is another disease. Okay, so the diseases which we saw are like furuncle or a boil. A furuncle or a boil is nothing but an infection of the hair follicle. Hair follicles like everywhere. So like in the lowermost part of the septum of like the nose, there will be like hair follicles, and so if that gets infected, it's called a furuncle. A furuncle, in simple terms, is called boils. It's a Staphylococcus aureus infection. The predisposing factors, so like not everybody gets this infection. So like what makes you get the infection? If you're going to do a persistent hair pricking, so like the fimbriaceae is like the nasal hairs, another name, technical term. So like if we're gonna do that, so like the trauma from nose picking, plucking of the nasal hair, that is going to cause like furuncle or a boil. And then another disease is called vestibulitis, meaning like the inflammation of the vestibule is like vestibulitis. So like this video is going to be a very short video, because vestibule does not have that many diseases as the video we saw in the external nose. So if you did not see the video for the disease of external nose, just like go now, see it. Make sure you write everything in a pen and paper, and make sure you revise it. All right, so vestibulitis is just like trauma and staph aureus. So like you're gonna plug the hair in the vestibule, and vestibule is gonna get inflamed, as simple as that. Stenosis is nothing but closing. So like something is getting narrowed, so the passage is getting narrowed. That is stenosis, right? So accidental or surgical trauma to the nasal tip or the vestibule is stenosis. Example is Young's operation for atrophic rhinitis. It involves raising the skin flaps, vestibule to close the nares. So that's like the Young's operation for atrophic rhinitis. Young's operation is nothing but we are closing the nostrils. So like in dead bodies, we close the nostrils with cotton, something like that. Except that we're not using cotton in Young's operation. We are using actual skin flaps raised from the surrounding area, like from the nasal septum, there's a flap from the vestibule. Yeah, so like from the vestibule, we're raising the flap, right? So that is gonna cause stenosis. Okay, stenosis is like complete blockage. Atresia, no, stenosis is like narrowing, but atresia is like a complete blockage. Well, atresia is nothing but a congenital anomaly. What happens is that there's this epithelial plug in the nose, so like that is supposed to canalize, so like that's supposed to form an opening through which the air can pass inside, right? So if that's not going to happen, it's called non-canalization of that epithelial plug. So that is going to cause atresia of the vestibule, right? Moving on to the clinical features of all these diseases. So I'll show you the picture of a furuncle. So that's how a furuncle looks like. It's like red and it's like swollen, it's tender. So like we won't be clearly able to see the inside the hair follicle as such, but like if a nose looks like that, that's kind of like furuncle. Yeah, that's like excoriation around. This is like an abscess in the vestibule. This is kind of like atresia and stenosis, and that's some carcinoma. It's like squamous cell carcinoma. This is atresia, so like you can see there's a small opening here, that's stenosis, and this is like complete blockage at atresia. And here this is like a alveolar cyst, a nasolabial cyst, like that. And this is kind of like the surgery, Young's operation. That's how we're like closing the whole of the opening. This is just showing the nasal plug. Alright, so that's, yeah, pretty much it. So this is furuncle. A furuncle, clinical features are there's just like too much pain, too much tenderness. A furuncle will spread to the skin of the nasal tip and the dorsum of the nose, and it's red and swollen. It will resolve spontaneously, but sometimes it can complicate to form cellulitis of the upper lip and septal abscess. So that was the picture I showed you over here. It's kind of like an abscess, but it's not arising from the septum technically, but like it can also happen as a complication. Vestibulitis can be of acute and chronic nature. So like acute attack is just red, swollen, tender vestibule. Crust and scales cover the whole area, and chronic crust is going to be present. Induration and painful fissure with crusting will be present. So it's just like in vestibulitis, secretions come out and the secretions dry out, and that forms like crusting. It's as simple as that. Stenosis or atresia, we already know, it's just like the nasal cavity appears smaller, and like if it is completely blocked, it's called atresia. Nasoalveolar cyst is a smooth bulge. It's present in the lowermost part of the floor of the vestibule, so like it's a nasoalveolar cyst. So the alveoli we're talking about is like the alveoli of the teeth, so like the root of the teeth, right? So the swelling is from there. Papilloma is human papilloma virus is the cause of it. It's a wart, so like it can be a sessile wart, it can be pedunculated wart, so it's just like pinkish tissue here and there. That's a papilloma. Squamous cell carcinoma is mainly happening in the lateral wall of the nose. It's just some tissue growing in there, maybe black in color, but if it's black, mostly it's melanoma. So squamous cell carcinoma is mostly like pink in color, right? Treatment is very simple. If it's a furuncle or a boil, we know it's an infection, so you use antibiotics, and then there's a lot of pain, so like give analgesics and warm compression. And if it is a fluctuant swelling, so like if there's a lot of pus, we do an incision and drainage, but like just caution the patient, they're not supposed to break it open with a needle or break it open with your fingers, because like it is in the face, and like face has the brain, right? So like the head has the brain, so there is a risk of cavernous sinus thrombosis. We don't want a cavernous sinus thrombosis, which is why we're not supposed to do this particular thing. All right, moving on to vestibulitis. Vestibulitis is also an infection, so you have to use antibiotic, but it's kind of like you have to prevent the infection from spreading, so you give anti-inflammatory drugs like steroids. But mainly you have to clean the vestibule with some very good cleansing agent, which is hydrogen peroxide. Okay, and there's a lot of fissures. So let me show you a picture of the fissure here. So this is the fissure which happens in vestibulitis. It's kind of like crusted and like fissures. So those fissures have to be cauterized using cautery. For stenosis and atresia, you have to like do a recanalization procedure, obviously plastic surgery, and nasoalveolar cyst has to be removed by sublabial approach. So like underneath the upper lip, you're gonna go and excise it. Papilloma and squamous cell carcinoma is you have to do surgical excision. For squamous cell carcinoma, in addition, you can give radiation. As a quick recap about the vestibule, vestibule is a nose part which is present in the nose ring area, so like the central nose ring. We saw a good number of diseases like inflammation of the vestibule, inflammation of the hair follicle in the vestibule called furuncle. We also saw atresia and stenosis. We saw some tumors like papilloma and squamous cell carcinoma. So like this kind of looks like a papilloma, but obviously you have to take a biopsy to confirm. Yeah, that was it. This is a squamous cell carcinoma. All right, that will do. So keep revising. Do comment down your doubts below. Thank you. Stay smart.